All right, Landon, I'm making this video unlisted. Unlisted means nobody else can see it, and here's why. I'm not supposed to assign exercises, but I know what nerve pain feels like. I actually have carpal tunnel on my wrist. Fun fact, I don't really talk about that too much, but I do. I have nerve entrapment. It hurts when I kind of deviate side to side like that. So I know what you're feeling. I'd like to say, first off, if you haven't, went to seek out like orthopedic advice like an MRI, I'm not telling you to get an MRI, but let's make sure we're addressed there. Let's make sure we are working with professionals. I don't care if you work with me or my boss or a PT, but don't do it on your own. It's probably the first thing I'd say is make sure, and I know you're probably working your ass off this, but make sure you're with the right people and make sure you know the right people, because pain sucks, and I know where you're at from this and my shoulder. I will share you 2 exercises. The first thing I'd like to say is you're entrapped. Your nerve is entrapped. It is pinched. Sometimes surgery can unlodge it. That's what people do. Other times you can create space, you can create range of motion, and the nerve will come undone. Doesn't always happen, but sometimes it does, right? So the first thing I'd like to say is if you can't fully get your elbow straight or touch your shoulder there like that, that needs to be done ASAP without stretching. So the first exercise I'd tell you, I'm sure you've seen our joint moves, is straight elbow flexion and extension. I want that done like 300 times a day. In the morning, give me 100. In lunchtime, give me another 100. Do them without stopping. So I'm saying both arms, flex and extend over and over and over and over again, nonstop. That's what I did. Fun fact in my process, I didn't do a bunch of impulses. I did shoulder flexion and extension, and I fixed my arm. Well, Brady fixed it for me, but that's what you have to do. Over and over and over again. Not scap work, not IYTs. You have to move your elbow, right? I'm going to show you an impulse. If you're going to attempt this impulse without training with us, please check with your parents or PTs, orthopedics, your coaches, blah, blah, blah. I'm not your coach. I'm just here to help. I'm not here to blindly give you physical therapy because I'm not a physical therapist. I'm a baseball coach. Take the strap. We're going to put it around here, around like waist height, right? It's called elbow release impulse. Take the strap here. We're going to put it on our wrist, and we're going to flare our wrist back. So my wrist isn't here. Flared back. We're going to flare it back. We're going to hold it out kind of in front of our quad, and we're just going to tap. Just like that. Look how soft that is. That's it. Do this like twice a week, and we're just going to tap. Just like this. Over and over and over again. It's going to feel really good kind of in here. If there's pain, stop. But just kind of go like this, right? Over and over and over again. It feels pretty good at this intensity. And it's just going to kind of desensitize this area. I do this. I'm not going to give you sets and reps. Just like twice a week, maybe like later at night, and just kind of knock it around a little bit, or in the morning. Do this until it feels good. No reps, no nothing. Just kind of just go like that, right? Make sure you have a good strap there. You just desensitize that elbow. I hope that helps.